There's something incredible happening inside of you right this very second. It's this silent, vital force that keeps your entire body up and running. Today, we're going to pull back the curtain and really understand what it is: blood pressure. But before we jump into all the numbers and the science, let's just start with a simple question. What is this silent, powerful force that's constantly at work inside you, keeping you alive and functioning every single moment? Well, stick around because you're about to find out. All right, let's dive right in. Time to reveal exactly what this silent force is. And it all starts with your heart and this incredible, massive network of vessels that it supports. So, what are we actually talking about here? Well, put simply, blood pressure is just the force of your blood pushing against the walls of your arteries. That's it. Every single time your heart beats, boom, it's pushing blood out to the rest of your body. And that push, that's what creates the pressure. Okay, here's a really easy way to picture this. Think about a garden hose, right? When you turn on the water, that flow creates pressure on the inside walls of the hose. It's the exact same idea in your body. Your arteries, they're the hose, and your blood, that's the water. It's really that simple of a concept. So why is this pressure so ridiculously important? Well, think of it like your body's own personal Amazon Prime and trash collection service all rolled into one. Seriously. That pressure is what makes sure fresh oxygen and all those vital nutrients get delivered to every single one of your cells. And on the flip side, it's also what helps haul away the garbage. Waste products like carbon dioxide. Without that pressure, nothing gets delivered and the trash just piles up. All right, so I'm sure you've heard those numbers before, right? Someone says their blood pressure is 120/80. But what does that actually mean? Let's decode this thing. So that classic reading, 120/80, is pretty much considered the gold standard for a healthy adult. And that little mmHg you might see on the machine, don't let it intimidate you. It just stands for millimeters of mercury. It's just the unit of measurement, that's all. Kind of like how we use miles per hour for speed or degrees for temperature. Okay, this is where it gets really cool. Let's break down those two numbers. That top number, the bigger one, that's called systolic pressure. It's the pressure when your heart is actively contracting to pump blood out. Think of it as the maximum force, the big squeeze. Then you've got the bottom number, the diastolic. That's the pressure when your heart relaxes between beats. It's the chill phase, the baseline pressure that's always there in your arteries. So having a normal pressure is fantastic. It's what we're all aiming for. But what happens when that system goes wrong? This is where we get into the danger zone, the highs and the lows, and it's exactly why paying attention to this stuff is so, so important. Basically, it can go wrong in two main ways. On one hand, you've got hypertension, that's high blood pressure. This is when the force of the blood against your artery walls is just consistently too high. And on the other hand, you've got hypotension, low blood pressure. That's when the force is consistently too low. And let me tell you, this is exactly why they call high blood pressure the silent killer. Because over time, that constant hammering force can seriously damage your arteries. We're talking about huge health problems down the line, things like heart disease, stroke, and even kidney failure. It's serious stuff. Now, low blood pressure is a different beast. It tends to show up with more immediate symptoms. See, if the force isn't strong enough, your blood just can't get where it needs to go efficiently, especially to your brain. And that's why it can cause things like dizziness or even fainting. It can also lead to something called poor organ perfusion, which is just a fancy way of saying your organs aren't getting the oxygen-rich blood they desperately need. Okay, so this all leads to a really practical question, right? What actually affects these numbers of yours? Well, it's not just one thing. It's a whole mix of different factors, some of which are in our control, and some, well, not so much. And yeah, the list of things that can influence your blood pressure is pretty long. You got the stuff you can't really change, like your age or your genetics. But then there's a ton of stuff that's tied directly to our daily choices. Your diet, for instance, stress levels, how much you move your body, even habits like smoking. All of these things are constantly working together, kind of like a big control board fine-tuning the pressure inside you. So let's bring this all home. Why does any of this matter to you? I mean, on a personal level. It's because your blood pressure is, without a doubt, one of the most important vital signs you have. It's a window into your overall health. And this right here, this really gets to the absolute heart of it. Regular monitoring is important because it often changes silently. That's the key word, silently. Especially when it's getting higher, it can creep up without you feeling a single symptom. It's just happening in the background. When it's all said and done, it really boils down to this one simple, powerful truth. Just knowing your numbers, what they are, and what they mean for you, that is the single most important first step you can take to protect your heart and build a longer, healthier life for yourself. At its heart, you can really think of blood pressure as a simple physics problem. Imagine your circulatory system is just a big plumbing network. Your heart is the pump, and your arteries are the pipes. Hypertension is what happens when that pump has to work way, way too hard, fighting against pipes that are too narrow, too stiff, or just plain overfilled. So let's start with those pipes, because the physical state of our arteries, that's really ground zero for understanding why the pressure builds up in the first place. Now take a look at this. It's a perfect side-by-side comparison. On the left, you've got a healthy artery. Think of it like a brand new, flexible garden hose. It expands easily with each pulse of blood, keeping things nice and smooth. But on the right, in a hypertensive state, that artery is stiff, it's narrow. This creates a ton of resistance, and it forces the heart to pump with so much more force just to get the job done. This increased resistance is absolutely fundamental to the whole problem. But what's causing the arteries to get so tight and constricted anyway? To figure that out, we have to look at the body's own control systems, which, in this case, have been kicked into overdrive and just won't turn off. First up is the sympathetic nervous system, or the SNS. The easiest way to think about it is as your body's fight or flight alarm. It's designed to ramp everything up when there's an emergency. The big problem in hypertension is that this alarm gets stuck in the on position, keeping your body in a constant state of high alert. And when that alarm is blaring 24/7, you get some very specific consequences. It tells your heart to beat faster. It tells your blood vessels to squeeze down and get tighter. That's vasoconstriction. And you put those two together, you get a much higher cardiac output, which means more blood is being shoved through those narrow pipes every single minute. Now, the SNS isn't working alone. Right there with it is another crucial system, the renin-angiotensin-aldosterone system, or just ROS for short. If the SNS is the alarm bell, you can think of the ROS as the body's emergency crew that's in charge of keeping the pressure up. But just like the alarm, this crew doesn't seem to get the memo that the emergency is over. And this shows you exactly how that crew operates. It all starts in the kidneys. When they think the pressure or flow is too low, they release an enzyme called renin. This sets off a chain reaction that creates angiotensin II, which is one of the most powerful vessel constrictors in the entire body. But it doesn't stop there. It also triggers aldosterone, a hormone that tells your body to hang on to salt and water. Now remember that part, because it's going to be really important in just a minute. So here's where things get really nasty. This constant state of high alert and high pressure isn't just a temporary issue. Over time, the pressure itself starts to cause actual physical damage, which creates a dangerous, self-perpetuating cycle. I mean, just imagine the force of your blood hammering against the inside of your arteries day in and day out. This constant abuse damages the super delicate, single-cell thick inner lining, which is called the endothelium. And this isn't just a minor scratch. It fundamentally changes how the blood vessel actually works. See, a healthy endothelium releases a critical molecule called nitric oxide. Its job is basically to tell the blood vessel to relax and widen up. But when it's damaged by all that high pressure, it can't produce as much nitric oxide. So the very mechanism that's supposed to fight the constriction is now broken, which just promotes even more constriction. It is a classic vicious cycle. But the damage isn't just chemical, it becomes structural. The constant strain from the high pressure actually forces the blood vessels to adapt, but in a really bad way. The scientific term for this is vascular remodeling. Essentially, the walls of the arteries grow thicker and more muscular to try and withstand the pressure. Now, you might think that sounds like a good thing, like a protective measure, but it's not. It actually makes them even more stiff and even more narrow. This remodeling can permanently lock in that state of high resistance, turning hypertension into a chronic condition that's much, much harder to fix. Okay, so we've spent a lot of time on the pipes getting narrower, but let's go back to our plumbing analogy. What's the other way you can crank up the pressure in a system? By putting too much fluid in it. And this is where that hormone aldosterone from the ROS cycle comes back to haunt us. By telling the body to hold on to salt, it also forces the body to hold on to water, which increases the total volume of blood in your system. This can also be driven by problems with the kidneys or even something as simple as a diet that's consistently too high in sodium. And from there, it's just simple math. More blood volume means the heart has to pump a greater amount with every single beat. This increases your cardiac output, which, when you combine it with vessels that are already constricted, sends your blood pressure even higher. So we have all these internal systems at war with one another. But what's the spark that lights the match? Let's zoom out for a second to see the other factors that can either start this whole process or just make it a lot worse. So what are these big influences? Well, some of it is just genetics. You might be predisposed to it, but lifestyle factors play a massive role. Things like diet, being overweight, and not getting enough exercise. And then you have factors like chronic stress or smoking, which can directly overactivate that fight or flight system we talked about, kicking off the whole terrible cascade. So when you put it all together, you can really see what a complex feedback loop hypertension is. You have overactive alarms squeezing the pipes. That pressure then damages the pipe walls, making them stiffer. And this whole mess is made even worse by having too much fluid in the system. We can break these choices down into 3 core pillars: smart eating, active living, and healthy habits. By focusing on these 3 areas, you can make a massive, massive impact on your blood pressure. So let's start with smart eating. The go-to plan here is the DASH diet, which stands for Dietary Approaches to Stop Hypertension. It's all about focusing on fruits, vegetables, whole grains, and lean proteins. And critically, it means limiting sodium to less than 2.3 grams a day, while also boosting foods rich in potassium, because potassium actually helps your body get rid of excess sodium. All right, on to the other 2 pillars: active living and healthy habits. This means getting in some regular aerobic exercise, like a brisk 30-minute walk most days of the week. It's a real game changer. It also means, you guessed it, limiting alcohol, quitting smoking for good, and finding healthy ways to manage stress. Each one of these habits directly helps get your blood pressure into a healthier range. Now, this is a really critical point I want to make sure it lands. Lifestyle modification isn't just for people with borderline numbers. It is the foundational, recommended starting point for every single person diagnosed with hypertension. It's the bedrock that all other treatments are built on. For many people, these lifestyle changes work wonders. They're incredibly effective. But sometimes they just aren't quite enough to get to that target goal. And that's okay, because that's when it's time to bring in the next level of defense: medical treatment. Okay, this chart shows the main classes of medications your doctor might consider. You've got things like ACE inhibitors and ARBs, which help relax your blood vessels. Calcium channel blockers work in a similar way. Then there are thiazide diuretics, which help your body get rid of extra salt and water. And beta blockers, which help your heart beat with a little less force. Each class works on the problem from a different angle. And choosing the right medication is definitely not a one-size-fits-all situation. It's a completely personalized decision you'll make with your doctor. They'll consider your age, any other health conditions you might have, and just how you respond to the treatment. It's truly a partnership. So far, we focused a lot on treatment. But what if we could avoid getting to that point in the first place? This last section is all about the amazing power of prevention and how we can proactively start building a healthier future. You might be looking at this list and thinking, wait a minute, this looks familiar. A balanced diet, regular exercise, limiting salt and alcohol? Yep, they're the exact same habits we use for treatment. And that's the beauty of it. The best way to protect your health is to be proactive from the start. The big takeaway here is really just to be proactive. Regular blood pressure screenings can catch risks early, which allows you to step in and make changes before things get serious. This approach is absolutely fundamental to staying healthy for the long term.